Is my mic on? Okay. I just need to talk closer. Good morning. Thank you, everybody, for being here. Thank you, staff, for being here. Conferees, thank you so much for being here. We're going to change up a little bit here just very quickly. Our first item of business will be House Bill 2170, designating the first full week of February as Kansas Burn Awareness Week. Carly?
Mr. Chair, Committee, House Bill 2170, as introduced, would designate the first full week of February every year as Kansas Burn Awareness Week. Later on in the section, it does give some reasons and what the bill hopes to accomplish, like commemorate a week of remembrance for all those who have lost their lives or have been injured as a result of a burn, and a few others. House Bill 2170 would take effect on July 1st, 2025, after publication in the statute book. And I can stand for questions.
Seeing no questions? Dr. Julia? Thank you.
Thank you, Chairman Carpenter and members of the committee. I appreciate you allowing me to come and provide proponent testimony today for House Bill 2170. Burns are some of the most devastating of all medical emergencies. According to the Centers for Disease Control and Prevention, over 400,000 people seek care for burn injuries every year. And of those who seek care, over 3,000 will die in this country each year. In the state of Kansas, burns contribute to unintentional burn injuries, which is the fourth leading cause of death. And of all the types of unintentional, burns are the sixth leading cause of death in the state of Kansas. Of all burn injuries that are admitted to the burn units in this country, the most common are fire and flame injuries. Scald injuries are a third of them. Contact injuries, electrical, chemical, and other types of burn injuries. Thanks to the advances in burn care, nationally there's greater than a 96% survival rate for our burn patients. Burn survivors may suffer extreme pain as well as difficult and demanding rehabilitation. They require access to many services through their lengthy healing process. House Bill 2170 would establish the first full week of February as Kansas Burn Awareness Week. This would align with the American Burn Association's recognition of Burn Awareness Week. By codifying this bill, Kansas would honor those who have lost their lives or suffered severe burn injuries, raise awareness of accidental burn injuries and fatalities, and also educate the public on effective preventive measures to avoid accidental burn injuries or fatalities. On behalf of the Burnett Burn Center at the University of Kansas Health System, and the Ascension Via Christi Regional Burn Center, we both strongly support House Bill 2170. We are grateful for Representative Essex's leadership on this important issue and respectively request that the Kansas House Committee on Health and Human Services favorably report this legislature. Thank you for your time.
Committee questions. Representative Bueller.
Thank you, Mr. Chair. So are there other states that do this? I know you have mentioned that it kind of ladders up with a larger organization, but I'm curious about other states.
So there is a national one being put forth for national recognition. My previous position was the burn director at the University of Cincinnati in Ohio, and we passed this legislature in Ohio, and that started last year. So this was the first year of Burn Awareness Week being officially, or I'm sorry, the second year of Burn Awareness Week being officially recognized in the state of Ohio.
Thank you. Thank you, Mr. Chair.
Representative Berquist.
Thank you, Mr. Chair. Thank you, ma'am. Is there or has there been a coordinated effort with public schools for burn awareness for children during this kind of an effort, or is it mostly to the adult population?
Most of ours currently has been to the adult population, but we are always open to education on all levels because our center, both our center and the center in Wichita, accept both adults and pediatrics. We're always trying to get the word out to both. So we're certainly open to partnering with anyone that's asking or interested in education from us. We don't have an initiative at this time currently going.
Thank you, ma'am.
Representative Rees.
Thank you, Doctor. Is this your specialty?
Yes, ma'am.
It is?
I'm the burn director at Burnett Burn Center.
And how many, off the top of your head, how many other physicians are involved?
At my center or
At the-
nationwide?
No, at the burn center.
So we employ 4 full-time burn surgeons and have 1 part-time burn surgeon.
Just wanted to say thank you for doing that.
Thank you. I want to draw attention. I also have Dr. Resch in the audience, who is the director at the Wichita Center.
Thank you for that. Committee, further questions? Seeing none, thank you very much for being here again.
Thank you.
Okay, committee, that closes the hearing on 2170. I'm going to open the hearing on 2218. And with that, we will have an overview from Carly. Thank you, Carly.
Thank you, Mr. Chair, Committee. House Bill 2218, as introduced, amends the definition of psilocybin in the Uniform Controlled Substances Act to exclude the pharmaceutical composition of crystalline polymorph psilocybin and adding crystalline polymorph psilocybin to Schedule 4 of the Uniform Controlled Substance Act. Section 1 amends KSA 65-4101, which lists definitions used throughout the Uniform Controlled Substance Act. It adds subsection 00, which states that psilocybin does not include the pharmaceutical composition of crystalline polymorph psilocybin, known as Comp 360, or any such trade name as approved by the United States Food and Drug Administration. Section 2 amends KSA 65-4111, which lists controlled substances in Schedule 4 to add any pharmaceutical composition of crystalline polymorph psilocybin approved by the United States Food and Drug Administration. Section 3 requires that for the changes made in Section 1 and 2 to go into effect, the pharmaceutical composition of crystalline polymorph psilocybin must be approved as a drug product by the United States Food and Drug Administration. Once that occurs, the Attorney General shall certify the drug product's approval to the Secretary of State. Upon that receipt of certification, the Secretary of State shall publish the certification in the Kansas Register. Section 4 that states that upon the date of certification in the Kansas Register, KSA 65-4101 and 65-4111 will then be repealed. House Bill 2218 would take effect on July 1st, 2025 upon publication in the statute book.
Thank you, Carly. Committee questions? Seeing none? Oh, Representative Ellis.
Thank you, Mr. Chairman. A lot of big names. I'll let you pronounce those. The Uniform Controlled Substance Act. It's at this time in there now. Is that correct?
Point of clarification, are you asking if psilocybin is currently in the act or the act itself is in statute?
It's right now, Uniform Controlled Substance. It's on that list. And they want to exclude it and put it on the Schedule 4 uniform?
It is not, as Mr. Chair, as I read it, it is not currently on the list. They are putting it's a little confusing. And maybe a conferee could clarify, but they're putting on the current list to exclude any form that would be approved by the Food and Drug Administration. So they're putting the exception for the approved form into the Controlled Substances Act. And perhaps a conferee could clarify that for me. Apologies.
Well, thank you.
Thank you.
Thank you, Mr. Chairman.
Committee, Representative Myers.
Thank you, Mr. Chair. Would this allow for, is this the substance that they use in research studies that they're conducting right now on psilocybin use for treatment of depression?
Mr. Chair, Representative Meyer, that would be a question for the conferees.
Okay, thank you. Sorry.
Further questions? Seeing none, thank you, Carly. Okay, next we have Tess Bettler, Senior Manager. Thank you, Tess, for being here.
Of course. Thank you so much for
And
having
I
me.
understand this is your first time in Kansas?
It is, yes.
Well, welcome to Kansas.
Thank you so much. I really appreciate it. I'm loving it so far. So Chairman Carpenter, members of the committee, thank you for taking the time to consider HB 2218. My name is Tess Bettler, and I'm the Senior Manager of Advocacy and State Government Policy at Compass Pathways, here in support of the bill today. This bill would remove from Schedule I an FDA-approved form of crystalline polymorph psilocybin. This bill does not decriminalize or legalize psilocybin or any other psychedelic substance, nor does this bill allow access to drugs that have not been FDA-approved. As you know, psilocybin is currently a Schedule I drug both federally and in Kansas, meaning it is considered an illegal substance with no medical use. However, pharmaceutical-grade formulations of synthesized psilocybin are currently being studied for mental health conditions, including treatment-resistant depression and post-traumatic stress disorder. Treatment-resistant depression occurs when a patient suffering with major depressive disorder is failed by 2 or more medications of adequate dose and duration during a single depressive episode, and that occurs in approximately 1/3 of people being treated for major depressive disorder. In the event that a prescription drug containing crystalline polymorph psilocybin is approved by the FDA, the DEA will be expected to make a rescheduling decision soon after approval, allowing for prescription medical use of the FDA-approved product in the USA. As Kansas law does not allow for automatic following of the DEA's rescheduling decision, it is imperative that legislation be passed in anticipation of a potential FDA approval of a new and innovative treatment, such as crystalline polymorph psilocybin. Doing so will allow patients in your state with difficult-to-treat mental health conditions to have access to new treatments approved by the FDA as quickly as possible after approval and DEA rescheduling. If the FDA does not approve it, then nothing happens in Kansas. In short, this bill helps accelerate access for patients to innovative mental health treatments that have been FDA approved. Unless and until an FDA approved and DEA rescheduled product is also rescheduled in Kansas, patients will not have access to it. Thank you for your time, and I'm happy to take any questions.
Very good. Thank you very much. Committee, questions? Representative Ruiz.
Thank you for your presentation. What form is this administered? Is it a pill? Is it a powder, an injection? Or?
Yeah, it's a great question. It's a 25 milligram capsule, so it's a pill.
Okay.
Yeah, and it's given in a doctor's office.
May I ask another question, Mr. Chair? Is it called by any other name other than the really long name?
No, because we're not approved by the FDA yet. We don't have a trade name.
Okay, thank you.
Yes.
Representative Bryce.
Thank you, Mr. Chair. Thank you, ma'am. Just a quick question to clarify. You're saying that the FDA will make a scheduling recommendation after research to the DEA, and the DEA will do the reclassification possibly from Schedule I to Schedule IV, and that if we pass this law, it will basically speed up the ability to use the medication in Kansas. If it is not approved by the DEA, then, or the classification is not changed by the DEA, then there will be no changes.
That would be
correct.
correct.
Does that summarize it?
Yes, sir, that would be correct.
Okay, thank you.
Representative Ellis.
Thank you, Mr. Chairman. On page 2, down at the bottom, number M, it says dispensers. A pharmacist who dispenses or a physician's assistant who has the authority to dispense prescription drugs only. It'll be a doctor's office or a pharmacist.
Sir, it will be in a doctor's office that this will be given, entirely in a doctor's office.
Not pharmacies.
I don't believe so. That will be dictated by our risk evaluation and mitigation strategy as laid out by the FDA. So that has not been determined yet.
Thank you.
Of
Thank
course.
you, Mr. Chairman.
Representative Berquist.
Thank you, Mr. Chair. Because I don't know where to start, I'm just going to start. What are the characteristics of this substance? What characteristics and what reaction does it have in a human body that is beneficial for treatment that you believe?
Of course, Mr. Chair. So it's not exactly known the exact mechanism of action of psilocybin or really any crystalline polymorph psilocybin, but what it's thought to do is create new connections in your brain and increase neuroplasticity in your brain.
And how was that presumption come to, or that possible presumption?
Sir, a lot of research has gone into this. We still, again, don't really fully understand why it works, but there's been a lot of studies that suggest that it may work.
And maybe one more question. How long has it existed?
Sir, I'm actually not sure. Thousands of years, probably. It's been around. It is like derived from a natural plant, so it's been around for quite a long time.
And what natural plant?
It's a certain type of fungus, a certain type of mushroom.
Okay.
Yeah,
Thank you.
of course.
Representative Ruiz.
In this committee in the past, when the Food and Drug Administration is changing a substance from one schedule to the other, like from 1 to 4, or I guess it could go the other way, but from 1 to 4. Then someone from like KDHE comes to us and asks us to make that change. That's not what you're asking.
Sir, yeah, we are asking for it to be done, to have it on the books preemptively. I will say that this would only really take effect once something is FDA approved because of the language in the bill.
I have a follow-up question. So you are representing Compass Pathways, and it's according to your testimony, you're a pre-commercial biotech.
Mm-hmm.
So this is in an effort to jump right into the market. And are you going to produce this, or are you going to market it, or?
Chair, once we are FDA approved, we do plan to market it and sell it, but that will only happen once we are FDA approved. We're just trying to make sure that we've created an environment where patients can have access to a treatment once it's FDA approved.
Thank you.
Of course.
Representative Bueller.
Thank you, Mr. Chair. So if I understand you right, the non-synthetic version, this is the mushroom, or what people would call as a magic mushroom, some of the psychedelic drugs. I am a veteran. I have combat deployments, and so the PTSD part of this is intriguing to me. And so I kind of get where you're going, but can you tell me about either other states or other countries that have either trial locations, and any of the preliminary data that would suggest these are effective treatments? So that's my question. So thank you, Mr. Chair.
Of course, Mr. Chair. So we have a variety of clinical trial sites currently across the United States. What I can do is I can send you one of our papers from our most recent clinical trial that really kind of delineates the results of that one. I think that'd be helpful.
And if I can follow up with that, so
Yeah.
so the second part of my question, I apologize, Mr. Chair, is what would be that trial plan? Are you plugged into, okay, we're going to do something in Wichita, or we've got a trial location and pick a place in Kansas? Is there any, are you that far down the road on any of this?
Mr. Chair, not to my knowledge, I don't believe we have a clinical trial site in Kansas. I know we have one in Iowa and Nebraska nearby, but I don't believe we have one in Kansas.
Representative Meyer.
Thank you, Mr. Chair. I was trying really hard to listen. I may have missed it if you already expressed this, but how is this drug manufactured? Is it the actual psilocybin mushroom, or is it a purely synthetic version?
Mr. Chair, it is completely synthesized. The reason we do that is because we need to make sure every single dose is exactly the same to ensure that the patient is getting the right amount every single time.
Thank you, Mr. Chair. Just a quick follow-up. Could you explain how that drug is synthesized, what the methodology that you use to synthesize it into a synthetic version of psilocybin?
Mr. Chair, I'm sorry, I don't have that information. I can definitely ask around my company for you with my manufacturing folks. Of course.
Representative Rivas.
Yeah, thank you for the presentation. Just for frame of reference, I spent about almost 24 months in pharmacology research at KU Med. So, and I have a DEA number, I'm a prescriber. So I'm looking at this and I'm like, the whole scientific model, we're still in the trial phases. We're not there yet. And there's a time frame. And the FDA, they may not approve this. They may say, throw it to start over. They may say it's great. But I know one thing, it will not be fast. So I feel like, am I wrong? We're kind of ahead of the horse here. We're getting the cart ahead of the horse. We're like, maybe we should get the approvals and it may be a year from now, and this committee would be happy probably to approve it. So, I mean, well, I want you to explain what the timeframe, what's the hurry to get this approved? Is it an impending approval? Is it about to be completed by the FDA and the DEA? Is that going to happen quickly? Is there any idea on that?
Mr. Chair, I would say we are not expected to finish our clinical trials until 2026. However, I will say that you have, this body has in the past approved something like this kind of ahead of time. So a drug called Epidiolex was approved a couple of years by this body ahead of its FDA approval, just to make sure that, you know, the ground was laid.
Okay, thank you.
Representative Weichel.
Thank you, Mr. Chairman. Actually, Representative Bueller and Representative Rivas asked my questions.
Very good. Thank you. Committee, further discussion. Representative Reeves.
Thank you. Thank you, Mr. Chair, for indulging me. So I've looked at the opposition. It's a written only, and I've looked at the opposition, and they're raising some issues here, and it's similar to what I've already heard. And that is, what is this going to do with those who grow their own mushrooms? I know in the bill, it says something about if you have 5 bags, I think it is. There's something about, something in the bill that has a number to it. And so people are growing their own mushrooms. We know that. Yep. I'm a kid from the 70s. I knew people that were using mushrooms. But how might this, and you're saying that it's all synthetic, but how might this affect those who grow mushrooms not for, you know, not to get, you know, high or feel this euphoria, but because they're using it and they're cooking with them? What is the potential for any of that happening?
Mr. Chair, it was not our intention to interfere. It was not our intention to interfere with anything besides the Uniform Controlled Substances Act. I'm sorry, I don't.
Representative.
Oh, I'm sorry. I'm done. Thank you.
Okay, very good. Thank you. Representative Berkowitz.
Thank you for second opportunity. You said it's all synthetic, so is there nothing organic in it?
Mr. Chair, not to my knowledge.
Okay, because when I first asked, you said that it's been existed for a long time. So in chemistry form, it has been existing in nature.
In the natural form, yes.
All right. So, but
this is, yeah.
All right. Thank you.
Of course.
Committee, further questions? Representative Bryce.
Thank you, Mr. Chairman. Thank you, ma'am. I had a quick question. You used a term called neuroplasticity, which might have gone over our heads a little bit. One of the things that has been very frustrating is treating PTSD with current medications that rely on neurotransmitter manipulation, dopamine, serotonin, and epinephrine, different things. This is a completely different animal, and I don't know if that fully sinks in, but it's never been done before, to my knowledge. But it actually creates new pathways rather than tinkering with the volume of neurotransmitters in existing pathways. Mm-hmm. So I just didn't know if you wanted to make a comment about that, because it seems very interesting to me.
Mr. Chair, I'm not a scientist, but you know, essentially what we're trying to do here is really change the way that mental health care is delivered and how people are able to respond to these treatments. So yes, it's incredibly innovative stuff. It's very interesting, and you know, I just really appreciate your words.
Committee, further questions? Representative McDonald.
Thank you, Mr. Chair. A couple summers ago, I read a book called Entangled Life, How Fungi Make Our Worlds, Change Our Minds, and Shape Our Futures. by Merlin Sheldrake, and it was really, really interesting to me. I have had friends who have done the magic mushrooms on their own, and I'm kind of a prude, so I've never done any of those things. But I am excited about the possibility of new mental health treatments. And one thing that you said about how this pill would be given in a doctor's office, I think is kind of a key point for me, as someone who's a little more conservative when it comes to trying new things. But I'm really excited about this branch of science. So thank you for being here.
Mr. Chair, appreciate that.
Committee, Representative Blesk.
Thank you. Is the goal when we get all this transitions to be able to allow pharmacies to dispense it legally?
Mr. Chair, basically this will allow us to ship and for prescribers to prescribe.
Okay, thank you for that, because my experience with mushrooms is gathering morels in the spring, and they're dang good, but nothing else.
Different kind of mushrooms for sure.
Committee, further questions, discussion? Seeing none, thank you very much for being here. So committee, I'll bring your attention to opponent written opposition testimony from James Davis, and then also neutral testimony from Alexandra Blasey from the Board of Pharmacy. So with that, I will close the hearing on 2218. I might take just a moment of privilege. I have a page here, Quentin and his father, Brian, are up here from home, El Dorado. Quentin, welcome to committee. And I might add, he kind of likes this process, which kind of scares me. Future representative from the 75th district there. So anyway, all right, thank you. Thank you, committee, for a little indulgence. Okay, I'm going to open the hearing on 2159, and we're going to get an overview from Carly. Thank you very much.
Thank you, Mr. Chair. Committee, House Bill 2159, as introduced, creates the Emergency Opioid Antagonist Assistance Grant Fund to provide emergency opioid antagonists to law enforcement agencies and removes law enforcement from the State Board of Pharmacy's statewide opioid antagonist protocol. Section 1 establishes in the State Treasury the Emergency Opioid Antagonist Assistance Grant Fund, which shall be administered by the Attorney General. The stated goal of the fund is to provide assistance to law enforcement agencies across the state in purchasing emergency opioid antagonists for law enforcement officers to carry when such officers are on duty. Small agencies will be given priority to receive monies from the fund, and only agencies that adopt a policy requiring the administration of an emergency opioid antagonist shall be eligible to receive a grant. On July 1st, 2025, and every year after, the Director of Accounts would transfer $4 million from the State General Fund to the Emergency Opioid Antagonist Assistance Grant Fund. Section 2 amends KSA 65-16-127 to remove law enforcement officer from the definition of first responder. Additionally, it specifies that a first responder agency does not include any law enforcement agency. Section 2G4 states that any law enforcement officer who, in good faith and with reasonable care, administers an emergency opioid antagonist to a person experiencing a suspected opioid overdose shall not be subject to civil liability, criminal prosecution, disciplinary action by a professional licensure entity, or any professional review. HB 2159 would take effect on July 1st, 2025, after publication in the statute book.
Questions of Carly? Representative Reeves.
Thank you, Carly, for the explanation. Does this bill complement the bills that the bill that we passed last year that allows EMS to carry the Narcan, and leave some in the home if they went to a home?
Mr. Chair, Representative, I will look up that bill and I will confirm it for you.
Thank you.
Further questions of Carly? Seeing none, thank you very much. Okay, next we will open the testimonies. We have proponents. First proponent is Ed Klump, Kansas Police Officers, Sheriff's Association, among other things. Ed, welcome to committee.
Thank you, Mr. Chairman. My name is Ed Klump, and I'm here representing the Kansas Sheriff's Association, Kansas Association of Chiefs of Police, Kansas Peace Officers Association. This bill is helpful to us in encouraging more agencies to carry the naloxone or the Narcan, whatever you want to refer to it as. And that's why we're here supporting it. Section 1 of the bill would create some funding that would help. We have been very fortunate over the years since this came around of grant money being available, but we still have a lot of agencies who are having to purchase this Narcan for use, and so that part of the bill would be very helpful to us. Section 2 of the bill is one we requested to be added. This statute was created when Narcan first came out, and it was a prescription-only drug. And so we had to have things in place that would allow us to obtain this drug by prescription, even though we didn't have a patient, per se, to name. And so this was worked on by a group of people, including the Board of Pharmacy, which led that, and we came up with this methodology to allow us to do that. Now that it's not a prescription required for this, anybody can get it over the counter, anybody can administer it, anybody can carry it. And we still have some of these things that for law enforcement is kind of a burden on us. And particularly if you look at page 3, lines 23 to 24, there's a provision in there that we have to have a medical director. This is the only thing that law enforcement has to have a medical director for. And so that's an additional cost to us. We believe that some of our small agencies, and keep in mind that about half of the agencies in Kansas have 10 or fewer officers, about a third of them have 5 or fewer officers. So we're talking about very, very small agencies. And having this requirement on every agency to have a medical director is a cost to them, which may keep them from doing this. And another issue is, in some of those rural areas, we may not be able to find a physician who's willing to take that on. And so that's the main reason we're trying to get out from under this. I've explained in my bill, or in my testimony, how we got there. I'm not going to go through all that in that second paragraph, but it does retain the liability protection for law enforcement that exists in the statute today. And Mr. Chairman, this bill has generated a lot of discussion within our ranks, and I may be requesting an amendment before you work this bill. And I know time is short, but I'll be getting with revisers and talking about the possibility of doing that. We think we come up with maybe a cleaner, shorter, clearer way to do this and accomplish what we need. And with that, I'll stand for questions.
Very good. Thank you for that. Committee questions? Representative Weichel.
Thank you, Mr. Chairman. This question by no means is meant to say we can put a price on a life, but I am just curious because I have no idea how much a dose of Narcan costs. So when you say it's cost prohibitive for your agencies, and I know there's a number in here, like what's the quantity we're talking about that this would provide? Like how many doses or?
Well, you know, the more rural you get, the more important it is that all your first responders have access to it, because the time before actual EMS crew gets there is longer. In our metro areas, you know, we respond pretty quickly, but it's still important to have this because, like all medical emergencies, time is of the essence. I don't know what the quantity that we would be talking about. And you asked, I think you mentioned price. At one time, these were up about $50-60 a dose, I think. I don't know what the price is now that it's been taken off the prescription list. I could find out, but I don't know that off the top of my head.
Committee further, Representative Steens.
Thank you, Mr. Chair. Thank you for your presentation, Ed. Do you know, is there, because of the medical director verbiage in there, is there like a certain time frame that Narcan has to be given in? Like,
Not-
in other words, like when you get to the scene, is there like like assessing the patient and then you have to say, okay, we know this is a overdose or we think there might be fentanyl involved, or how does that, I'm just
So,
asking because I wasn't sure.
A little bit out of my expertise, but to my understanding, the Narcan is still considered to be a quick response when you have an unresponsive person. Narcan does not cause any harm if the person is not suffering an overdose. But most of the time, we have other evidence around. We know that's potentially what's going on. But it's one of those things, and it's literally saved countless lives across the state. Our interest is trying to get more of it out in our first responders' hands, and so I don't think there's any timeline. The only reason that we were included in this, I was in on those discussions when this statute was developed, and the only reason that medical advisor there is we needed a doctor for the prescription process.
Thank you.
Representative Ruiz.
I was looking for the fiscal note on the bill. I didn't see one. What do you anticipate the cost, and where is the money coming from?
That part of the bill is not initiated by us, and I don't have the answer to that question. We worked with Representative Proctor on that. I don't know if he has that information or not. Our part of the Section 2 of the bill has no cost, so other than hopefully we'll get it in more people's hands.
I believe Carly mentioned it was a $4 million to be transferred from the state general fund during her testimony. Committee, further questions? Representative Bueller.
Thank you, Mr. Chair. Thank you, Ed. So, and thank you for presentation. So is this considered best practice legislation, or when the Peace Officers Association or the Sheriff's Association crafted this legislation, what other models did you look at? I know you're talking about some tweaks through amendments or whatever, but I'm interested in what would be considered best practice, and are we really getting best practice in our state with this legislation?
We didn't look at any other legislation or statutes outside the state of Kansas. Like I said, I've been involved in this process since it first started, and so I have that knowledge of it. But basically what we're trying to do here is reduce the cost to our agencies and take them out from under that medical director requirement.
Okay, thank you. Thank you for the answer.
Committee, further questions? Seeing none, thank you, Ed.
Thank you.
Next, we have Jennifer Ebert. Jennifer, welcome to committee. And if that's a prop, we don't allow props. So if you'll just, very good. Thank you for that.
Thank you. Thank you for the opportunity to be here today to speak. My name is Jennifer Ebert. I'm not only here as a concerned citizen, but as a grieving mother. On September 5th of 2021, my son Jason lost his life to fentanyl poisoning. He was just 21 years old. That Sunday morning at 8:19, I received a call no parent should ever get. The sheriff told me to get to Jason's house immediately. EMS was there performing CPR on him. When I arrived, minutes later, I was told we could not go in his house. Jason's roommate came out in shock of what had happened and told us that Jason had been making strange noises in his sleep. He tried to wake him up and realized that something was terribly wrong. He called 911. The first officer responded quickly, but did not have naloxone, the life-saving medication that would have reversed Jason's fentanyl poisoning. My son had to wait for EMS. Seconds turned to minutes, and every moment without oxygen matters. At 8:37 a.m., my son was gone. Jason didn't have to die. If naloxone had been available, he might still be here today. That's why I fully support House Bill 2159. This would give officers, law enforcement agencies, the access that they need to naloxone and to remove any unnecessary barriers. We are facing a fentanyl crisis that does not discriminate. Families across Kansas are losing loved ones. Law enforcement officers are often the first on the scene of a fentanyl poisoning or an overdose. But if they don't have the tools to save a life, they're helpless. Just as the officer that responded to my son's call for help. Passing this bill would save lives. It gives law enforcement officers the ability to act immediately instead of waiting and wasting precious moments. It means that the next parent doesn't have to stand powerless as I did. Jason's life matters. Every life lost to fentanyl matters. I urge you to pass House Bill 2159 and give our law enforcement the tools they need to prevent more unnecessary deaths. Thank you for your time and consideration.
Jennifer, thank you, and I know I can speak for this whole committee that we are sorry for your loss.
I appreciate that.
Committee questions? Seeing none, thank you very much.
you.
Next, we have Amber. Amber, welcome to committee.
Hello, my name is Amber, and I want to thank you for the opportunity to share why this bill is important. Losing a child is a pain no parent should ever have to endure. It is through the loss of our daughter, Kaylee, that we have found the strength to speak out in hopes of sparing others from the heartache her father and I live with on a daily basis. HB 2159 addresses a crucial issue, ensuring that the safety of our children is prioritized. By extending protections and ensuring accountability in the caretaking process. This bill offers the opportunity to prevent future tragedies. It is a step forward in safeguarding our children, not only by making important legal changes, but also by sending a message that we will not stand by while our children are at risk. It's important for every officer to carry naloxone because they are often the first to arrive at emergency scenes, including opioid overdose. Naloxone can quickly reverse the effects of an opioid overdose, whether that be illicit or prescription. By helping save lives and restore breathing until medical help arrives. With the opioid crisis still widespread, having naloxone on hand allows officers to provide immediate help and potentially prevent deaths. Sorry. The loss of a child has changed my life forever. And while no legislation can ever fully ease the ache and the grief, it can help prevent the needless loss of other children. By passing this law, we can make meaningful strides in protecting vulnerable people. Please consider the lives of countless children, sisters, brothers, friends, mothers, fathers, and grandparents whose lives will be spared. This bill is not just about changing laws. It's about saving lives and ensuring that no other parent has to endure the kind of loss that my husband and I have experienced. Please support this bill and be a part of saving future generations and protecting Kansas families from experiencing this trauma and grief. Thank you for your time and consideration.
Thank you, Amber, and I express the sincere sorrow for the entire committee for your loss, so know that.
Thank you.
Committee questions of Amber. Representative Berquist.
I'm sorry, I didn't hear, ma'am, how long ago did you lose your son?
I lost my daughter August 25th, 2023.
Okay. Thank you.
Committee, further questions? Thank you very much again for being here.
Thank you.
Committee, I'll bring your attention to a written-only proponent from Ashley Ritchie, a private citizen, and a neutral testimony from Alexandra Blasey from the Board of Pharmacies. Okay, committee, with your permission, I would like to return to working a bill that we heard yesterday, 2039. If it's the committee's will, I'd like to work that bill. Are there objections? Seeing none, I will open the hearing, or I will start to work. I would entertain a motion to work. Representative Bueller.
Yes, Mr. Chair, I will entertain a motion to pass out favorably House Bill 2039.
I have a second by Representative Ellis. Discussion committee. Seeing none? Oh, Representative Steins.
Thank you, Mr. Chair. So I wasn't here yesterday. I know you guys probably heard me echoing in this room, and I'm so sorry for that because I know I have a very loud voice. So my only question was, we're just changing the language, correct? Because they had home health agency, and they want to make sure it wasn't home health care or something like that. Is that correct?
Carly.
Mr. Chair, Representative, that is correct.
Okay. I just wanted to clarify that because I was a little confused when I was listening to some of the testimony with everything. Thank you.
Committee, further discussion. Seeing none, Representative Bueller, you may close.
Thank you, Mr. Chair. I close.
You've heard the motion. All in favor, say aye.
Aye.
Opposed, same sign. Bill passed. Committee, with your permission again, I will direct your attention to the bill that we just heard here today, 2170, designating the first full week of February as Kansas Burn Awareness. With your permission, I would like to work that bill. Are there objections? Seeing none, I would entertain a motion. Representative Weichel.
Thank you, Mr. Chairman. I move that we pass the bill out favorably.
Do I have a second? Second by or Representative Berquist, sorry. Discussion committee. Seeing none, you may close.
Thank you, Mr. Chairman. I close.
All in favor, say aye. Aye. Opposed, same sign. Motion carries. Bill is passed. Committee, as we all know, it's a pretty fluid situation. We will work Friday. We might work Friday evening. I have no idea. We just have a finite amount of bills to get done, and we need time to do that. So I will be respectful, but we also have a job to do. So we might work over on Friday. We might work late instead of at 1:30. We may work, I don't know. It's just all fluid. So enjoy yourselves tomorrow, and and above all, be safe out there because the weather conditions are terrible. So we're adjourned.